Javier Becerra, thank you so much for making time for us.
Ashley, thank you.
This is a hard job at a really hard time. Why do you want to be California governor now?
Because it's a hard job and you need someone who's gone through these tough times and knows what it's like to have to balance a big budget, someone who knows what it's like to deal with emergencies, crises, and knows how to get out of them. Someone who knows how to fight and someone who knows how to win. I'm getting to do what my parents didn't have a chance to do, and that is live a life based on your dream, and I'm getting to do it with people who also want to see California thrive. So why not?
California, though, is facing multi-year money problems. If, whoever the next governor is really going to have to deal with that, according to our state's legislative analysts, budget experts, in really every side of the aisle at this point. The options that have been laid out are to either cut spending, cut state programs, or raise taxes. Which option do you see yourself choosing?
Both. You got to do a little bit of both. I had to do that when I was secretary at HHS in the midst of the worst pandemic any of us had ever seen. I had to save lives, manage a budget, and do it without making cuts to the most essential programs. We were able to do that. We got the economy and the country out of COVID. It took a lot of work, but you have to do it with a mix of measures. And I think in the case of California, we'll need new revenue. And there are people who aren't paying their fair share who have to pay a little bit more. At the same time, we have to take a look at programs, as I had to look at programs when I was at HHS, and we had to make decisions on where to cut to make sure that we balanced our books.
So you mentioned people needing to pay their fair share. So what does that look like? You're essentially saying you'd raise taxes on the wealthy in the state.
For the most part, yeah. Think of it this way. Not sure what bracket you're in, what tax bracket. All I know is that there are people who are paying doctors, nurses, teachers, firefighters, police officers, folks who you think of in the middle. If you're making way more money than any of those professionals and you're paying at a tax rate lower than them, you're not paying your fair share. So I think it'll be pretty quick or pretty easy to calculate if you're going to have to pay a little bit more. Because if you're paying less in taxes and you're a billionaire and you're paying less than that teacher in your effective tax rate, you're likely going to have to pay more.
How exactly would that happen under Governor Becerra?
So we would try to have a policy on revenue that is predictable and consistent. That's one thing I've learned that when I was on the Ways and Means Committee in the Congress. Ways and Means Committee is the tax writing committee. So I did tax policy for about 20 years. What you need to do is give people predictability. You want people to pay their taxes, they got to know more or less what they're going to owe at the end of the year. You want a business to be able to invest in your state, they got to know what they're facing in terms of taxes and regulations. Give them predictability. And so I would make sure that we are developing a tax code that gives people predictability. That means if you know you're paying an effective tax rate lower than that teacher or firefighter, you should expect you're going to be paying more at the end of the year.
But I mean, California's budget does rely heavily on the state's top earners. I mean, the top 1% account for like almost half of the income tax that the state collects. Do you risk, I mean, potentially driving them out of state and putting us in an even worse revenue situation than we could be?
No, because think of it. Most of those doctors, lawyers, a lot of those professionals who are making $300,000, $400,000, $500,000, $800,000, $900,000, $1 million, I'm not looking to go after them because they already are paying a sizable tax to the state of California for their income. I'm talking about folks who don't have that wealth because of their income. They have it because of their investments. And investments in this country are taxed at lower rates than the effective tax rate of that firefighter and that teacher. And it's because so many billionaires have their wealth in those investments that they get off without paying a fair share of taxes to the state where they make their living, where they love to enjoy. And most of the folks that I've encountered who are fairly wealthy don't mind paying their fair share. And they're willing, so long as they can understand why they're being taxed. So long as it's predictable. Everyone understands we pay a premium to live in this great state of California. Go take a look at the price at the gas pump today. We're paying a premium, mostly because Donald Trump got us into this reckless foreign war. But I will tell you, we like California. We want to stay in California, but it's got to be affordable.
You mentioned you'd also cut programs. Is there anything like immediately on the docket that you see that you'd want to cut right now?
I would take a real close look at these homeless programs. We have not had accountability. I believe that every dollar that we invest in homelessness is going to be a very precious dollar. And I'd like to make sure that it leads to results. And results for most of us are, when I look at those streets, I don't see people lying there in the morning having slept there. I want to see results. I want to have accountability. I'm willing to invest in having assistance for those who are homeless, but we have to have results. And if you can't produce the results and that accountability, then you shouldn't get the money.
So, because I mean, cities and counties might watch this right now and think, oh my gosh, are you talking about HAP, the Homelessness Housing Assistance Prevention Grant Program? It's the main way the state provides dollars to these local governments. I mean, is that something that would be on the table for you to potentially cut?
I would certainly make sure that they are delivering results. And if they can't deliver results, I'll take that dollar to someone who is delivering results. And so we have to make the best use of that dollar, because there are always programs that have to deal with something like homelessness. I only have so many of those dollars. If I have to make a decision, I'm going to put that $1 into that one organization that's delivering accountable results.
Another expensive program right now, and we have yet to really see the effectiveness of this one, is providing health care to undocumented people through the state's Medi-Cal program. Would you keep that in place as governor?
Absolutely.
Right now, I mean, new adults can't sign up under changes that the governor and legislature had to make last year because of the financial situation with it. Would you look at trying to allow new adults to sign on?
I understand what the thinking was. I think that's short-sighted, and it's not cost-effective. And Ashley, that one's an easy one. You've got a family, you've got a child, your child's hurting. You don't have money, you don't have insurance. You're going to think of everything you can, from going to get the aspirin to trying the massage in the curandera if you're from a Mexican home. Whatever you can, that's not going to cost you an arm and a leg. But if your child's still hurting, at some point, you're going to the hospital. And if you don't have insurance, and if you're not a wealthy person, that bill will drive you out of your house. Whatever nest egg you had has just gone. So if you were looking to use that to buy a house in the future, or to help pay for your kids' tuition to college, gone. But you're going to take your child to that hospital. Why should we wait till you have to take your child to the hospital, which means you're probably entering through the emergency room? The most expensive door to walk through in healthcare is the ER door. Why should we wait because you didn't have insurance, that you let the situation get so bad that now you have no choice but to save your child, you go to the hospital through the emergency room? I'm saying no. You're going to have access to that pediatrician, that family doc, that OBGYN now early up front, because it costs me so much less to do it up front than wait till it gets really expensive at the back end. So telling someone you don't have insurance condemns them to have to use the back end, the most expensive care. I'm not going there. And I tell you this from my own experience, being secretary at HHS, from defending the Affordable Care Act as AG all the way to the Supreme Court. But I'll tell you where I learned it most, from two great Americans. My mom, who said, "Mi hijo es mejor prevenir que remediar." It is always better to prevent than to try to remediate. And Frederick Douglass, who said it about 160 years ago, "It is easier to build strong children than to repair broken men." We wait till they go to the emergency room to repair broken men and women. If we had built them strong and healthy at the beginning, we'd be spending a lot less money. I'm not going to wait till they're broken and we spend a ton of money. I'm going to build them strong and smart from the beginning, and that means giving them access to health care.
I think a lot of people who supported this program see it as a righteous issue, as you have laid out. I think the question is, though, is that this program became a lot more expensive than state officials braced for. I mean, in that vein, it'll cost maybe a lot more. I mean, or is it just a matter of managing the state's budget better than it had been?
Well, Who's paying? If that family's not on Medi-Cal, when they do use the health services at the hospital, who's paying? Not Medi-Cal. So the state may not be paying, but you're putting that now on the county. Or you're putting it on the back of that doctor or that clinic or that hospital that doesn't get paid. And at some point they're going to say, I can only do business this way so long before I have to close my doors. I don't want clinics, doctors, and hospitals to close their door. Go to rural California. They're already closing hospitals. We can't afford that. And I'm not going to let it happen. Because as much as I think it's morally right, healthcare should be a right, not a privilege, economically, it is not smart to wait for them to use the most expensive care walking in through an emergency room. It is economically smarter to give people access early so they maintain their health. Our system in healthcare, unfortunately, and I kept saying this when I was secretary at HHS, our healthcare system is based on treating illness. Our system of health should be based on promoting wellness. So we avoid the expensive care. That's why the US, California, we have the most expensive healthcare in the world, bar none, and we still leave people without insurance.
I want to switch gears to another big part of the budget, which is education. I mean, almost half of the state's budget goes toward our public school system. But right now, with statewide teacher strikes coupled with these classroom performance issues, students struggling to just do basic science, reading, and math, how would you manage that situation as governor?
Well, I see two issues there. And let me start with the first, which I'll piggyback off of what I just finished saying about healthcare. You can't wait till a child is entering kindergarten, and now we have transitional kindergarten, when they're 4 or 5 years of age, to expect them to just launch. If their life from 0 to 4 or 5 has not been one that's equipped them to learn, they're not gonna succeed. And we're setting ourselves up and them for failure. And so it should not surprise us that so many of our children, by the time they're in 6th grade, by the time they get to middle school and high school, they're not at grade level. Mejor prevenir que remediar. Better to start early. Build a strong child. And so I think we make a major mistake that costs us less money to provide early care, education. So not just when they're 4 or 5. Think of all those parents who are struggling to find good daycare for their kids. And I don't mean just daycare where it's just you're watching that child during the day. Someone who can also provide them some basic education when they're 2 or 3 years old, so that when they get into pre-K, they're ready to learn a little bit in pre-K. So that then when we get into the 1st grade, they're ready to start learning. I would front load a lot of education so we make pre-K and early care affordable. Most families can't afford to pay tuition, college tuition, for a 3-year-old so they can go and work. And that's unfortunately what daycare has become. Child care has become essentially paying college tuition for your 2 and 3-year-old while you go work. That's incredibly hard, difficult to absorb. So early, upfront education first. Secondly, how is it that we expect a teacher to take those children and make them the next doctor, scientist, you name it, major professional, engineer? We want them to be able to teach our child to become that doctor, scientist, or engineer. But how much do we pay them? Way less than a doctor, a scientist, or engineer. Are you surprised then that there is massive turnover among our teachers' ranks, that after 3 to 5 years, they're out of there because they're just not making a good living and they can go make more money doing something else? We need the best and the brightest teachers to make that their career. Let's compensate them right. Let's focus our money. We do put most of our money in our state budget into education. So let's put it where it counts. Getting the best teachers and equipping the best classrooms so those kids who will have had some pre-K education are ready to learn.
But from your assessment, how is this not happening now? I mean, California is spending more money than ever per student on education. The budget is bigger than ever on education. How is it not happening? Because
we have to spend a lot of money in doing remediation, because so many of our children are in their grade but not at grade level. And so we're doing a lot of work to help them catch up. That costs a ton of money. We're also spending too much money on things that have nothing to do with the classroom. Too much bureaucracy. and I would cut some of that out as well, and then focus the money where it counts. Same thing as with healthcare. I'd rather put my dollar into that doctor instead of that pencil pusher, that money cruncher, that accountant who's trying to figure out the best way to game the system when it comes to charging or paying for that healthcare service. Give it to the doctor, give it to the nurse, give it to that hospital technician who's helping the doctor or nurse, rather than give it to the accountant who's trying to figure out how to scheme and game the system to get the best reimbursement or to avoid paying more than necessary.
This is a good segue into my next question. I mean, you sort of mentioned a couple ways with healthcare and education, but just with this national conversation about government waste, spending, potential fraud and abuse, how would you protect California's taxpayer dollars?
The way I had to do it when I was Attorney General. We had to, one, enforce laws. Sometimes people weren't happy. We'd tell them they have to do certain things. We'd say, you should have read the law before you decided to do that business, because the law is pretty clear. All we're doing is having you follow the law. So if you said you were going to pay somebody minimum wage, by law, you must pay them minimum wage. You can't steal their money. That's called wage theft. So we enforced the law and said, you hired somebody, you had them work, they provided you labor, now you owe them the money. And you can't say that, oh, woe is me, I didn't realize I was underpaying. Follow the law. And so we have to enforce the law. We also have to make sure we do constant oversight. Delivery, as I said in my earlier answer to the homelessness question, there's got to be accountability. These are taxpayer dollars. They don't belong to me or anyone else in government. They belong to the taxpayers. I have to show that I've spent their money well. I can demand accountability. Oversight, accountability, and enforcement are the ways you drive this. I had to do that when I was AG all the time. I had to do it when I was Secretary of Health and Human Services, because when you're in the midst of a monumental pandemic like COVID was, and I had 50 states screaming at me saying, we need more vaccines, we need more Paxlovid and treatment, we need more ventilators, I had to figure out how I was going to distribute all of those items to save lives to 50 different health authorities, 50 different governors, all demanding what they needed. And we didn't have everything that they wanted at every minute of time, so we had to distribute. We needed to know how to do that. The way you do that is by having oversight. The way we were able to know when to send vaccines to certain hotspots is because we demanded the data. We were able to spot the hotspots and then be able to direct the resources where they were needed most. We have to do a much better job in government to make sure that we are enforcing accountability, oversight, and we'll get some things done.
Speaking of following the law, I mean, you were a victim of a crime that really, I mean, shook Sacramento this past late last fall. A couple of people who are close to you are now facing prison time for it, for stealing nearly $250,000 in your campaign funds. I know you've said it was a gut punch to see that Dana Williamson, who's a well-known political consultant, your former chief of staff, had this scheme essentially to funnel money from your campaign account to this longtime chief of staff of yours. I mean, I just want to confirm on the record here, like, you were really, truly misled there.
Yeah, as I said, gut punch. You put your trust in people, but what you also have to remember is, as much as you've had a working relationship over years, as much as you've done things together and succeeded in so many ways, at the end of the day, we're all accountable. The law is the law, and no one is above the law. And so when accountability comes knocking your way, you got to show up. And so I don't think anyone will challenge what the law is, and we all have to face up to it. But it was a real gut punch.
This scheme, I mean, involved taking $10,000 a month up to from this dormant state campaign account of yours. And I mean, looking through your congressional campaigns, I mean, dating back to the 90s, like, never once did you pay that amount for this kind of maintenance, for legal services, for nothing. I mean, like, did you really not, that didn't raise any flags for you, those payments?
So we were paying for management of a dormant account, making sure that no laws were violated. Because I was Secretary of Health and Human Services, a cabinet member, I had to distance myself from anything that looked political or campaign related. I had ethics rules that were in place that required me to distance myself. And so I depended on people that I trusted to be able to manage that the right way. we were going to pay for the management. You always pay for someone to oversee, to file the right documents and the rest. And I was willing to pay the price to make sure that I didn't have to worry about it. Lo and behold, while I was willing to pay a price, and by the way, the attorneys of the campaign account signed off on all those payments as well. It wasn't as if there wasn't someone who was checking. The attorneys were checking, and they were saying, you know, everything seemed kosher. What happened was, after the payments, the way the money was used is where the violation occurred. If there was no violation in terms of the payment, that's why I and my campaign were not implicated in the actual activities.
These, I mean, the people involved, I mean, a really well-known lobbyist and consultant, I mean, two of them, Dana Williamson, and one is escaping me right now. But I mean, these are powerful people in Sacramento. I mean, like, just not to speak for you, but it sounds like you were swindled or misled, as you mentioned. I mean, do you wish you would have gotten a second opinion? Because there are consultants up and down the state who I've talked to in the months since who said, like, that is an outrageous amount of money to pay.
Yeah. So I was getting an opinion, whether second or not, first or second opinion every time, because I had campaign attorneys who were watching over the account as well, who I also paid. And so never once did they flag that there was anything going on with the payment. The payment was substantial, but it wasn't by itself something that was illegal. And so when we made the payments, my attorney said they never objected to the payments.
The name just came to me, Greg Campbell, and a lot of his clients are major ones, or at least they were. Dana Williamson was chief of staff to Governor Newsom and Jerry Brown. I ask you to ask broadly for taxpayers who are watching this, how can they be sure that you won't be swindled or misled by powerful forces as governor when it comes to the use of taxpayer money?
I would just look at my record. When it came time to COVID, take a look at how we were able to get those vaccines, some 700 million vaccines by the time we had finished our 4 years in tenure. Some 700 million vaccines went into the arms of Americans. But perhaps the most important fact there is that never once do we have to ask Americans to pay 1 penny to get that life-saving treatment, because we knew that people who were uninsured or were low income would probably pass and say, I'll take my chances, I'll try to be safe, which of course meant if they were not safe, none of us was safe. And so the work that we did there, I would tell people, take a look at my record as Attorney General. If you want to see how I'll do my work, if I can be accountable, take a look at the work I did to protect our state at a time when Donald Trump was president the first time and was coming at our state, trying to assault us in so many different ways, very similar to what he's doing now. We stood up, we protected our state, whether it was health care, where I took the Affordable Care Act all the way up to the Supreme Court against Donald Trump and beat him, whether it was the DACA program for Dreamers, where he tried to eliminate it in the wrong way. We took him to the Supreme Court. We beat him. Whether it was protecting our clean car standards, whether it was protecting the right to choose and have reproductive health care services, over and over, we proved what we could do. If people want to see what I do, how I do it, and whether I can be accountable, I'd say take a look at that record.
Okay, I want to switch gears to probably what really everyone wants to know, which is how a Governor Becerra would lower costs for Californians.
Housing, get to building. You're talking to a former construction worker. My dad was, for decades, a construction worker. I knew how to wield a hammer before I knew how to throw a baseball. And so we're going to build. We're going to do it right. That means, and I think every one of the candidates will talk about how we're going to trim back on some of the regulations that make it tough to move forward. We're going to try to make sure, we're working with local governments, we try to eliminate some of the fees that make it very difficult to make a project pencil out. We're going to try to make sure that we look at the projects that are almost ready to go. There are thousands of units of housing that are essentially shovel ready, except something is missing. About 40,000 units of affordable housing are essentially shovel ready. In most cases, they're just missing that last tranche of funding. Let's kick that into gear and let's get to building. Because it's not just a matter of building.
Like the state is providing that tranche of funding, or who's providing it?
Well, the state does have some resources that I would pull on to try to help. But we're going to need some other resources as well. It shouldn't be just on the state. Local governments need to have that housing as well. And we could look at the industry and find out if they have ways that they can help us do this as well. So what we can do is kick those into gear, because they've checked all the boxes. They've got most of their financing. There's just one thing missing to kick those into gear. Let's get the shovel in the ground and start building those units that we need. I would make sure that within my first 100 days, I have moved to freeze property insurance rates, which have gone sky high, and utility rates, which continue to increase. So these private investor utility companies are making a profit, an automatic profit, guaranteed profit, while we're paying higher and higher bills, and we don't understand why we have to continue to pay so much. So whether it's on property insurance or utilities, I would declare a state of emergency on housing, be able to then freeze those rates on property insurance, do the same on utilities, give myself about 3 or 4 months working with the legislature, local government, and the industries to figure out what's going on. Let's pull the curtain open and find out what's behind those property insurance increases. Let's find out what's behind the curtain of those utility rate increases. If they can explain themselves, I think most Californians say, that's okay, I got it.
They might say that we have regulations piled onto us every single year. And in the same vein, I mean, should California rethink its climate goals or change them at all?
So first, if they're going to say that, I say, okay, show me. And show the public what those regulations are. And if it's true, and then we'll hear from the public as well, and maybe those are some of the rates we have to trim. But show me. Show me. I don't know about you, Ashley, but last year, my property insurance rates more than doubled. I don't live in fire hazard area. I'm in the Sacramento area. I'm not in brush country. Just doubled, more than doubled overnight. My mom, who'd had, I won't name the company, had been for more than 3 decades paying property insurance. I don't know if she'd ever filed a claim. She got dropped. Never an explanation. When she finally was able to get new insurance, more than double. I think we just want an explanation. Pull the curtain back, show me. If there's something going on that it's our fault, okay, then we'll deal with that. But show me.
On the climate goals, though, do they need to be changed?
We have to have goals that are achievable. I had to do that with COVID. I had to constantly tell people, we have to complete this. If we're going to save lives, we have to deliver results. And so on anything having to do with climate change, cleaner energy, when we have goals, they have to be achievable.
Is carbon neutral by 2045 achievable?
It's looking harder and harder to get there. We should strive to get there, but it's looking harder and harder. And what's the measure? How do you measure that? Could my parents meet that goal? My parents were working class family. Could my parents meet that goal? If my parents could meet that goal and they were working every day hard to just make a living and scratch out the best for their kids, if they could meet them, then it's not a good goal. But if they could, let's keep striving. Let's keep pushing.
A sooner goal is no more sale of new gas-powered vehicles in 2035. Is that achievable?
So my dad, all the years I knew him, drove a pickup, and not a new one. Would my dad have been able to switch out his pickup for an electric vehicle? I'd say chances are no, not right now. But if he could, then we should. So goals that are achievable, not goals that are pie in the sky. I think when these goals were first initiated, there was this belief that we could get there. Things have become very difficult, and we should not be shackled by goals because our families can't be driven day to day by things that are not achievable because they have to achieve. They have to make sure their kids can go to school. They have to make sure they've paid that mortgage or that rent. There's no striving in paying your rent. You need to pay your rent. You've got to have hard and fast, measurable results as a family, but as a state government as well.
You mentioned Donald Trump a lot. I know you stand on your record as the former AG that sued him dozens of times, but For those who do support him and other Californians who aren't Democrats, how will you represent them? How will you let them know that you're also a governor for them?
Because I want their families to succeed. That we don't agree on Donald Trump, that's the beauty of America and free speech and the First Amendment. But I want them to succeed. If they're working hard, then I want to fight for them. If they're trying to get their kids to college or the military or an apprenticeship program, I want to see it happen. If they want to buy a house, I'm going to try to help them. If they're tired of paying high utility costs, I'm going to try to find out behind that curtain what's going on. You know, it's governing, you realize real quickly, is not red or blue. Governing is about me and you and getting it done. And if you don't get it done, you could be red or blue, but you won't be in office very long. And so it's just a matter of getting it done. I'm not looking to be the, have my portrait above every mantle in every home in California. I want everyone to have a mantle and a home.
Okay, so 2 last quick questions. Speaking of getting it done, what grade would you give Governor Gavin Newsom for his last 2 terms as governor?
Oh. So you're talking to someone who's had a balance of budget bigger than the budget that Governor Newsom had to balance. You're talking to someone who had to deal with a crisis bigger than perhaps any crisis that the governor of California had to deal with when we had to save lives across the country with COVID. You're talking to someone who took on a rogue, menacing federal government the way Governor Newsom has had to do that. I did that when I was AG.
You are going to grade him. Are you going to grade him?
I am going to grade him,
okay.
but I'm trying to put it in context.
Got it.
So it is important to recognize when you grade someone, understand the shoes they're filling. Sure. It's not easy to be a governor of the biggest state, the 4th largest economy. So what I would tell you is this. We became the 4th largest economy under Gavin Newsom. Check. We have expanded healthcare to more Californians. Check. There are many things that he has done well. The other things, public safety, I think he could have been more ambitious. Homelessness could have been more ambitious, have people be more accountable. If I were grading, I'd say Gavin Newsom is going to go on to college because he's going to graduate from my high school. What grade?
What's the threshold for that?
What's the threshold?
Yeah, the threshold.
That he's left us in a place.
So like
where,
a C?
Well, I mean, you could go to college with a C. It's a lot more difficult. But I think he has done many of the things that we have asked him to do. And in some areas, well, when I become governor, I'll make sure.
But what's the grade?
I don't know if I can give him a grade.
I thought you were going to grade him.
Well, I was going to try, but what I'm telling you, I wasn't in his shoes. I know a lot of folks who gave me a grade on COVID and say, oh, that guy was terrible. But they're still alive. They get to go out and not have to wear a mask. I mean, you can grade anybody the way you want. It's whether you left the place better than you saw it and you started. I would absolutely say he has. He's tried. And knowing how tough it is to manage an enterprise the size of the state of California as the Department of Health and Human Services, the largest public health agency in the world, with a budget, as I said, bigger than the state of California, I know what it's like. And it's easy to grade. It's tough to accomplish.
Okay. So not A through F. You won't give me an A through F.
No, I mean, I'm not. That's not for me to say.
Okay. So last question. What are 3 words that you would use to describe California under Governor Becerra?
Bold, focused, decisive.
Javier Becerra, thank you so much for your time.
Thank you, Ashley.